Hi everyone, welcome to week 6 of your Pharmacy Career Planning 1 course. We are now on the downhill side of this course, so we are in the last half. You should be getting your midterm grades from me soon if you haven't already. So please make sure you're checking your email for that so you can see where you're at. You'll also see some recommendations from me on what you can do to improve your overall score before the end of the course. This week we are just wrapping up chapter 4. You read about half of the chapter last week, and so we're finishing that chapter this week, and then you'll have a quiz over the full chapter this week. So we were talking about the legislation and the regulations for long-term care pharmacy. So what we're doing now is we're just kind of picking up with some of the actual who's and what's of legislation and regulation. So who is part of that regulation and what do they do? So the Drug Enforcement Administration is a federal agency that that monitors controlled substances. So that is why they are involved, because obviously there are some controlled substances used in long-term care settings. And basically, obviously all of the rules apply to the long-term care locations, but the most important thing that is covered in the drug enforcement rules and regs is two different things that are typically something that we have to deal with in a long-term care situation. One is a partial filling of a prescription. So if we're only giving them part of a prescription rather than the full one, and there's a couple reasons for that. Maybe we don't have it all, or maybe maybe the facility is, not wanting to fill the whole one because of the condition of the patient. Maybe they're afraid the patient might expire or something. But, for whatever reason, we want to only fill part of that prescription. And then what do we do with those prescriptions when that patient is no longer a patient? Whether they've been discharged or whether or not they've passed away or whatever the reason, what do we do with those controlled substances? So destruction of those is another part of the regs that applies specifically in a long-term care setting. And then, of course, in all settings, regardless of whether or not they're long-term care or not, the DEA regulates how we get those prescriptions by fax, because we have to have something in writing for the Schedule 2 drugs. So they do allow you to fax, but we have to actually have that written prescription at some point. So that's it. So it kind of goes through and regulates that piece of it. What do we do with that? Then we talk about the automated dispensing systems within a long-term care system. We wanted to allow that, so the DEA went through and allowed that to happen, but there is some special regulations around that. Also, expiration dates on medications. Anytime we package a repackage for a long-term care facility, we have to make sure there is an expiration date on that repackaged material. And based on what it is, there's a beyond use date of a year for non-sterile solids and liquids that are packaged in unit dose containers. And then just 1 year for multiple dose and 60 days for multiple dose medication packages. So, and then again, what do we do with the returns? What do we do with the things that patients are no longer using? And that's what this part discusses a little bit. We have a lot of money that goes into the medications for a long-term care facility in those patients. What are we going to do if they change their therapy? What do we do if they they're discharged or they pass away, things like that. So, the American Society of Consultant Pharmacists updated, their statement on that. And, they have gone through and mandated certain things. So shorter fill cycles for Medicare patients, 14 days or less, things like that, to help reduce waste. So that's what you're going to learn about in the second half of this week's material. Of course, there's also state regs. Those are going to depend, obviously, on your state. So just if you are employed in a setting, you want to make sure, whatever type of setting it is, that you're looking at the state regs for that particular type of facility, because they are going to differ from state to state. And just keep in mind, and I know I've mentioned this in other lectures before, but it's kind of like who's the more strict parent, right? Federal government versus state government. So we always go with the most restrictive rule is the one we have to make sure we follow. So if the state's more strict than the federal government, that's the one that we have to make sure we're aware of. So if you have any questions as you read through this week, please make sure you reach out and let me know, and have a great week.